Endocrinology, pituitary hormone, thyroid hormone disease, thyrotoxicosis. Lesson 1. Let's talk about differential diagnosis of hyperthyroidism, grave disease, toxic nodular goiter, toxic nodule, thyroiditis, and extrathyroidal source of thyroid hormone. TSH. In grave disease, toxic nodular goiter, toxic nodule, its decrease. Free T4 T3 radioactive iodine uptake increase in grave disease, toxic nodular goiter, and toxic nodule. In grave disease, TSH receptor antibody is present. Toxic nodular goiter and toxic nodule, there are no antibodies. Thyroiditis. TSH decreased, free T4, T3 increased, thyroid antibodies up to 50% of cases, thyroid stimulating immunoglobulin, thyroid peroxidase antibody, thyroglobulin antibodies are present. Radioactive iodine uptake is decreased in thyroiditis. Next, differential diagnosis of hyperthyroidism is extrathyroidal source of thyroid hormone. It is divided into endogenous and exogenous. Endogenous types are stroma ovary, ovarian teratoma, metastatic follicular carcinoma. In this case, TSH decrease, free T3 T4 increase, there are no thyroid antibodies. In exogenous type, TSH decrease, free T3 T4 increase, no antibodies. Clinical features of thyrotoxicosis. Cardiovascular symptoms are tachycardia, atrial fibrillation, palpitation. Elderly patient may have only cardiovascular symptom, commonly new onset of atrial fibrillation. Gastrointestinal symptoms are weight loss with increased appetite, thirst, increased frequency of bowel movement, hyperdefecation. Neurological features are proximal muscle weakness, hypokalemic periodic paralysis. Genitourinary features are oligomenorrhea, amenorrhea, decreased fertility. Dermatological manifestations are fine hair, skin moist and warm, vertigo, plumber's nail, palmar erythema, pruritus. In Graves' disease, clubbing, pretibial myxedema. Musculoskeletal features are decreased bone mass, proximal muscle weakness. Hematological manifestation in grave disease, leukopenia, lymphocytosis, splenomegaly, lymphadenopathy is occasionally present. Ophthalmological features in grave disease, lid lag, lid retraction, proptosis, diplopia, decreased acuity, puffiness, conjunctival injection. This picture shows the clinical features of hyperthyroidism. Treatment of hyperthyroidism. Beta blocker for control of adrenergic symptoms such as palpitation. Antithyroidal drugs, thienamides such as propylthiouracil or methimazole. Radioactive iodine thyroid ablation for grave disease and toxic nodule or toxic adenoma. Surgery in the form of hemi, subtotal or complete thyroidectomy for toxic nodules. Surgery in the form of total or near total thyroidectomy for grave disease. Thank you.